I am explaining the hinge knee replacement because this type of question is asked by many people nowadays when they come to discuss regarding the knee replacement and types of knee replacement and revision of the knee replacement surgeries. You can see that this implant, this is a femoral component and this is an insert, this is a box here, this is a cam and this is a post. This post and when this cam sits here, whereas this and this implants are totally separate. Totally separate. So this is separate piece, this is separate piece. There is no link between this and this. That is a primary or semi-constraint type of implants. It can be primary implant and it can be semi-constraint. So these are one class of implants. So when we say hinge knee replacement, it is this kind of implants where this is a stem, this goes inside the leg bone, that is tibia. This is a stem which goes inside the thigh bone, that is femur. This is the femoral component, this is a tibial component, means this is a thigh bone component, this is a leg bone component. And here is, this is called bumper, and this implant when sits like this, we have to put something like a bolt. So when we put the bolt, it acts like this. These both are linked together with a hinge here. This is a hinge. So when we use this hinge knee replacement is whenever there is absence of the collateral ligaments, whenever this flexion gap and extension gap is too much mismatch which cannot be adjusted by the semi-constrained implants, and whenever there is loss of bone, we are doing second time surgery and third time surgery, or sometimes there is no ligaments. So in such situations, this type of hinge knee replacements are used. There is a stop. There is no extension. Means hyperextension. This leg cannot be extended after some range of movement. That is going to be stopped by the hinge. So hinge will control the movements and it will stop the knee after some range of movement. Person cannot extend further. That is called hyperextension stop. This is a specific function which is seen in hinge knee replacement than any of the other type of knee replacement. When we use primary knee replacement or constraint, person can still move. Still it is possible. Extension is possible. Mediolaterally there is some movement possible. Here you can see extension is absolutely stopped and mediolaterally there is no movement. This gives stability when there is absence of the ligaments.